So, have you ever really stopped to think about how deeply your mental well-being influences, well, pretty much everything?
It really does, doesn't it?
I mean, think about it. Your ability to laser focus on something tricky, the way you connect with people you care about, even those nagging physical things, aches and pains, it's all so deeply linked.
It absolutely is, and that interconnectedness, well, that's exactly what we're exploring in this deep dive, looking into the critical importance of mental health.
Right.
We're drawing from perspectives like the Cleveland Clinic, the World Health Organization, and Very Well Mind, too.
Yeah, it's a great mix. We've got info that helps, really nail down what mental health even is, then digging into the factors that affect it, and maybe most importantly, why focusing on it isn't just like a trend, but really the bedrock of a fulfilling life.
Exactly. Our mission here is to sort of look past the buzzwords and get to the core understanding of why mental health is just fundamental to overall well-being.
Okay, so let's get down to it. When we actually say mental health, what are we pointing at? The Cleveland Clinic, they summarize it pretty neatly.
They do. They talk about overall psychological well-being. So that's your emotional state, how you're thinking, cognitive function, and social functioning, too.
Right, emotional, cognitive, social. Makes sense.
And the World Health Organization, the WHO, they take a slightly, maybe wider view.
How so?
Well, they define it as a state of well-being where you can cope with life's normal stresses, the everyday stuff,
Okay.
and realize your own abilities, learn well, work well, and importantly, contribute to your community.
Ah, so it's about functioning within the world, too.
Precisely. And what's really key in the WHO definition is that it's not just about not having a mental disorder, it's a spectrum.
Like physical fitness. You can be anywhere on that scale.
Exactly that analogy. You can range from, well, not very fit mentally to incredibly resilient and well.
I like that.
Yeah.
And very well mind. Where did they fit in?
They align pretty closely, actually. They see mental health as driving how we operate psychologically, emotionally, socially, the whole package.
So again, coping with stress, being productive.
Yes, and contributing to society. It's a common thread.
What really stands out then, looking at all three, is the overlap, isn't it?
Definitely. Cleveland Clinic points out how it hits our self-esteem, our social life, finding meaning.
And even basic thinking, like memory and problem solving.
Right, and they draw that direct line to physical well-being and the presence or absence of actual mental health disorders.
And the WHO broadens that out, suggesting it underpins, well, almost everything. Decision-making, relationships.
Shaping the world around us even. It really highlights how foundational this all is.
The Cleveland Clinic brings up something really crucial, the idea that symptoms can be kind of invisible.
Yeah, that's a huge point. Invisible not just to others, but sometimes even to ourselves, right?
Exactly. Which explains why you can't just, look at someone and know how they're doing inside.
And they connect poor mental health directly to brain function, our cognitive abilities.
It's not just feeling down, is it? It actually affects perception, thinking clearly, memory.
Reasoning, finding solutions, all those core mental skills we rely on constantly.
And if those are impaired, it makes sense that it affects concentration, making decisions, learning.
Even just adapting to change, it can really disrupt how we navigate everyday life.
And the physical connection. I think sometimes we forget how strong that is.
Well, the Cleveland Clinic reminds us the brain is part of the body. It's not separate.
Right. So mental struggles can actually cause physical symptoms.
Yeah, and quite a range. Things like sleep problems, insomnia, maybe, or just feeling exhausted all the time.
Headaches, too.
Headaches, stomach issues, muscle aches, even heart palpitations. It really blurs that line between mind and body.
Wow. They mentioned the American Heart Association, too, didn't they?
They did, recommending that depression be seen as a risk factor for worse outcomes after, say, a heart attack, acute coronary syndrome.
That's a major statement from the medical field about that connection.
It really is. And this all ties into resilience, which the Cleveland Clinic also mentions.
Right. Good mental health isn't just avoiding illness, it's about being able to bounce back.
Exactly. Handling challenges, setbacks, big life changes, while keeping some kind of balance.
Makes sense. And then there are relationships. That seems obvious, but how does mental health affect them specifically?
Well, it really influences how we interact, how we communicate our feelings or set boundaries.
And empathy, understanding others.
That too. Good mental health just fosters more positive connections. It's harder to be a good friend or partner if you're really struggling internally, isn't it?
Real question.
And linked to that is self-image. Cleveland Clinic stresses how vital a positive self-view is for self self-worth.
So knowing your strengths, but also your limitations, maybe?
Yeah, in a balanced way. It helps build confidence.
And all these pieces, the cognitive, physical, relational, self-image, they add up to overall well-being.
Pretty much. Good mental health gives you the tools to manage emotions, handle tough situations, and, keep a generally positive outlook even when things are difficult.
Okay, so if that's the impact, what actually determines our mental health? What are the factors involved?
Right, good question. The WHO and Verywell Mind both shed light on this. It's complex, as you'd expect.
It starts at the individual level, I guess.
It does. The WHO mentions things like our emotional skills, maybe substance use history, and genetics.
Genetics. So things can run in families.
Well, Verywell Mind elaborates on that biological side. Certain conditions like autism, ADHD, bipolar disorder, depression, schizophrenia, they can have a genetic link.
Doesn't mean it's definite, though.
No, not at all. It's about susceptibility, not destiny.
Yeah.
But it's a factor.
Okay. Then there's the bigger picture. Social factors.
Huge factors. The WHO points to poverty, violence, inequality, even environmental deprivation, like lack of green space, maybe.
And Verywell Mind mentions specific environmental things, too.
Yeah, like how extreme weather might link to suicide risk or natural disasters to PTSD, even air pollution being linked to depression.
Wow, air pollution.
It seems so.
Yeah.
But on the flip side, they stress that positive social environments, good support networks, they can be really protective.
A buffer, kind of.
Exactly. And then there are our own choices, our lifestyle.
Right, like smoking, diet, alcohol.
Yep, very well. Mind and WHO both connect those smoking, poor diet, substance use, risky behaviors to a higher risk of issues like depression.
And early life.
Yeah,
That seems incredibly important.
profoundly. The WHO is clear. Harsh parenting, physical punishment, bullying, they're really detrimental.
And Verywell Mind talks about abuse.
Yes, childhood abuse, physical, sexual, emotional neglect. They make a stark point. It doesn't just raise the risk of mental disorders later.
But physical health problems, too.
Yeah, like diabetes, heart disease in adulthood. It shows how deep those early experiences run. It really shapes us.
Okay, so given all those influences, how do we, or how might someone, recognize that they or someone else is struggling? Are there signs?
Yes, and Verywell Mind offers a pretty good list of things to be aware of. They're not definitive diagnoses, of course, but potential indicators.
Like changes in eating?
Exactly, eating a lot more or a lot less than usual. Big shifts.
And energy levels.
A significant drop. That feeling of being wiped out all the time, even without a clear physical cause.
Okay, what about socially?
Withdrawing. Someone usually outgoing becomes much more isolated, avoids people.
That makes sense. And mood?
A persistent feeling of despair or hopelessness. That's a really serious one.
Wow.
Also, maybe an increase in using substances, alcohol, drugs, perhaps as a coping mechanism.
A red flag, maybe.
Could be. Also, unexplained confusion or maybe sudden anger, lots of guilt or excessive worry that seems, out of proportion.
Mood swings, too. Big ones.
Severe mood swings, yeah. Things that feel out of character.
And relationship suffering. More conflict.
Yeah, increased friction with family, friends,
Yeah.
difficulty connecting.
Okay, are there more severe signs?
There can be. Things like hearing voices, auditory hallucinations. That needs professional help right away.
Absolutely.
And any talk or indication of wanting to harm oneself or others, that's an emergency. Immediate help needed.
Got it. Anything else?
Just generally finding it much harder to do everyday tasks. Things that used to be simple suddenly feel overwhelming.
Yeah.
That can signal something's wrong.
It's good to know the signs, but let's flip it. What about the benefits? What does good mental health give us?
Right, very well. Mind covers this well too. It's not just about avoiding the bad stuff, it's about what you gain.
Like coping better with stress.
Definitely. A stronger ability to handle life's stressors, you tend to use healthier coping strategies.
And that positive self-image we talked about.
Crucial benefit. It fosters self-esteem, healthy ambitions, you see your strength.
And relationships improve.
Yeah, healthier relationships tend to follow. You can offer more support, affection, connection when you're feeling solid yourself.
Sure.
And interestingly, they also link it to productivity. Better focus, higher quality work.
That makes sense
Yeah.
if your mind is clear.
Exactly. And overall, it just leads to a higher quality of life. Maybe getting more involved in the community, trying new things, just feeling more engaged and fulfilled.
So it's clearly important. What can people actually do then to maintain or improve their mental health? What are the practical steps?
Great question. Both Cleveland Clinic and Verywell Mind offer guidance here. Lots we can do.
Lifestyle changes seem like a big one.
Foundational, really.
Yeah.
Regular exercise, moving your body, eating a balanced diet, getting enough sleep, that's huge.
And managing stress,
Yeah.
meditation, things like that.
Yes, finding healthy ways to de-stress. Meditation, mindfulness, deep breathing, whatever works for you.
What about professional help? Therapy.
Absolutely key for many. Psychotherapy, talk therapy, counseling. There are different kinds like CBT or DBT that help change thought patterns or manage emotions.
Cognitive behavioral therapy, dialectical behavior therapy.
Support groups can also be amazing, connecting with peers who get it, sharing strategy.
Real sense of community there.
Definitely. And sometimes medication is necessary, prescribed by a doctor or psychiatrist to help manage symptoms.
Right. Not for everyone, but an option.
An important option for some. And there are other therapies too, sometimes used alongside acupuncture, yoga, art therapy, music therapy.
Lots of possibilities.
The main thing both sources stress is checking in with yourself regularly, being honest about how you're feeling.
And reaching out.
Reaching out for support when you need it. Friends, family, support groups, therapists, even your regular doctor. Don't go it alone.
Very well. Mind also mentioned rest, right? And coping skills.
Yeah, prioritizing rest, actively learning coping skills, staying connected with loved ones, and trying to maintain a positive outlook. All important pieces.
Stepping back again, thinking globally. The WHO seems optimistic that things can be done.
They are. They emphasize that affordable, effective strategies do exist to promote, protect, and restore mental health.
But there's an urgency.
A real urgency for action worldwide. They talk about mental health having intrinsic value. It matters just because we're human.
And instrumental value, meaning it helps other things.
Exactly. It contributes to everything else in life and society. And as we've seen, it's shaped by individual, social, and structural factors.
So fixing it isn't just about healthcare.
No, that's a key WHO point. Promotion and prevention need to happen across sectors: education, work, justice, housing.
A whole society approach.
Yes. And they strongly push for community-based care, integrated with general health services. Make it accessible, reduce the stigma.
Less focus on big institutions, maybe.
More focus on care within the community. And bridging the care gap for common issues like depression and anxiety. Using things like non-specialists trained in basic counseling or digital self-help tools, getting support to more people.
They have plans for this.
They do. Their comprehensive mental health action plan running to 2030 and the big World Mental Health Report. They lay out a framework.
What's the focus?
Really three things: deepening the value society places on mental health, reshaping environments to be more supportive, and strengthening that community-based care.
And human rights are central.
Absolutely. Upholding rights, empowering people with lived experience to be part of the solutions, and that multi-sector approach that's got to involve everyone. So, wrapping this up, I think the main takeaway from all these sources, Cleveland Clinic, WHO, Very Well Mind, is just how fundamental mental health is.
Yeah, it's not optional, is it? It's core to our overall well-being. It touches every single part of our lives.
It really does. That ripple effect on our physical health, our thinking, our relationships, just our ability to handle the ups and downs.
And it's complex. It's that mix of our biology, our experiences, our environment, our choices.
Right, which means recognizing the signs when things aren't right and actively taking steps to look after our mental health. It's just essential for a good life.
Absolutely. So considering that deep connection, that mind-body link, and the huge societal impact that WHO talks about, maybe final thought for everyone listening. What's one small but maybe significant step you could take today, maybe for your own well-being, or even just to help create a more supportive space for the people around you?